Hello, I'm Dr. Barbara Boland. Welcome to my next edition of my video blog. Today I'm going to talk to you about the role of medication in holistic health. So I'm a person who's not a big fan of extremes in anything, and when it comes to the relationship between holistic health and medications, there are people who are very much in the extremes. On the one hand, you have physicians who really downplay the role that food, nutrition, and self-care play in terms of holistic health, or I'm going to, because it's my specialty area, talk about digestive health. And then on the other hand, you have holistic health practitioners who are 100% against medication. They see big pharma as evil and only believe that all medical issues should be addressed through alternative methods. I don't like either extreme. Let me give you a little backstory as to how my feelings about the importance of medication have developed. So when my oldest son was 3, in one fell swoop he was diagnosed with a pretty serious heart condition as well as a seizure disorder. His body was too little to undergo the procedure that would have corrected the heart condition, and so therefore he needed to be placed on medication. Well, between the heart medication and the seizure medication, this poor little child from the ages of 3 on was opening up his little mouth like a bird and swallowing medication 7 times a day. Let me tell you, as a mom, that was a lot to keep track of. And I really have to give credit for this little trooper who, even if he didn't like the taste of the medicine, he just swallowed it down. Very fortunately, at the age of 6, he was able to go in for a procedure on his heart, which fixed the condition, and by that point the seizures were no longer an issue, and he was able to get off the medication. But here is what I say: thank goodness for that medication. That medication prevented his heart from beating so widely out of control that it would have caused damage to the muscle, enlarged his heart, and therefore really stunted his growth. Instead, the medication allowed his heart to beat the way it was supposed to beat until he was big enough to get it fixed. And now he is a beautiful, fit young man who just ran his first 10K. I'm so proud of him. I don't know if that would have been his life if medication hadn't been developed. So why am I talking about this today? Well, it just so happens that within the past few weeks, by sheer coincidence, I was invited to 2 separate events given by 2 separate pharmaceutical companies, both of whom have a new medication for IBS out on the market. Now, you could tell me that I, drank the big pharma lemonade, whatever that expression is, but I will tell you that dealing with the individuals at both companies, whether they were the salespeople or the people in advertising, I didn't find them to be evil. I found them to be warm, caring, nice people. They truly and genuinely wanted to know what it's like for a person to live with IBS. Now, granted, they wanted to learn this so they could do their jobs well and sell medication. But again, is that a bad thing? If the pharmaceutical companies see that people are in need of medication for IBS and that there's money to be made, they're going to continue to do research. And with their research, they are going to develop medications that are effective and have less and less side effects, and that is a great thing. So, do I believe that there's a place for medication in holistic health for digestive disorders or issues? Absolutely. However, you don't want to go to the other extreme. You don't want to be the person who just goes to your doctor and expects that they're going to fix you. Like they say in those DirecTV commercials, don't be that guy. Don't be that girl. Because your doctor is going to be limited somewhat. They don't have a lot of tools that they can offer somebody who has IBS. And the other problem is that sometimes the medications are really just blowing the smoke away, but not getting to the underlying cause. In other words, not putting out the fire. And this is where holistic health comes in. So holistic means you're covering all ranges, all facets. So medication is one facet. Now, the great thing about medication, or when would I recommend somebody on medication, is if your symptoms are so severe that they're really, really impacting on your ability to function in your life, then that's a good time to go on medication. The other thing is that sometimes you need the medication to just get your symptoms down to a more manageable level so that you can function enough to Provide yourself with the foods that are good to help heal your body, that you are able to engage in the self-care strategies that, again, go to some of the underlying causes of what's going on with your belly. So I encourage you to not go to an extreme. See medication as part of your overall health plan, but also be sure that you are addressing the underlying issues and that you are learning which foods are absolutely right for your body and which things need to be in place in your life so that you can live the healthiest life that you can have. So whether you work with me or you work with someone else or you just try it through trial and error, keep at it. I assure you that your body is meant to be healthy and your body is meant to be well. You just got to figure out what it needs. All right. Thanks for listening. Great job. And I'll talk to you soon. Bye now.